Hi, everyone.
Hey, everyone.
Angelique here from Proactive Pelvic Health Center, and I'm here with Dr. Alexsia Priolo, who is our resident naturopathic doctor. Thanks for tuning in to today's talk. Sorry, we're starting a couple minutes late, but we're here. So we're going to get started, and we are going to start by just talking about endometriosis gut feelings. So, Dr. Alexia, maybe you can start by just letting us know, like, why this topic, why endometriosis gut feelings?
Yeah, so it's really interesting. There have been a couple studies lately talking about endo and talking about the gut. And the reason why is because people who often experience endometriosis, they'll experience abdominal symptoms as well. So typically we notice that, there's pain during the period, pain during sex, but there's also gas and bloating, constipation, diarrhea. And so these abdominal symptoms actually kind of correlate to IBS.
Okay.
And so a 2017 study actually showed that about 90% of women who have endometriosis actually, have these symptoms that I've just mentioned that correlate with IBS. And so it is, quite prevalent.
Why do you think that is?
I think it's because of the location of where the endometriosis can be found. So endo can be found all over the body mainly, but can also be found in the sigmoid colon as well as the rectovaginal space. And so that might elicit these feelings of gas and bloating and pain as well.
So do you think that affects a diagnosis of endometriosis?
Yeah, so I definitely think that it does. So you probably know this, but for women who are diagnosed with endometriosis, it often takes about 7 to 10 years for a diagnosis to happen after the symptoms are first reported, which is incredibly frustrating. And I think the reason why this might be is because in order to definitively diagnose endometriosis, you need to have surgery that's done. And so if you can kind of check mark boxes of these symptoms that a woman's experiencing and put them into this IBS category, then they'll say that they have IBS before even thinking of endo, because they, who really wants to go through with the surgery? And, ultimately this can be really frustrating for women.
It's true. And I see that in my practice as well. A lot of these women that come in with a diagnosis of endometriosis have been struggling with IBS or some other sort of chronic kind of persistent condition. So if it's not IBS, and IBS is probably one of the most common ones, but we'll also tend to see like a history or like an overlapping diagnosis of fibromyalgia, or migraines, as well as painful bladder syndrome or interstitial cystitis. So it tends to be overlapping for sure with endo, but I think you're right. IBS will typically be diagnosed a lot sooner, and then later on, a lot later,
they'll figure out that
a diagnosis of endometriosis. So if somebody has endometriosis and experiences abdominal symptoms, is there anything that they can do? Like, what would you suggest?
Absolutely. So a 2017 study just came out that looked at women who have endometriosis and women who have IBS. And what they did was put the women who have endometriosis on a FODMAP diet, because this has shown to be quite helpful for women who have, or individuals who have IBS. And the results were really promising. And it showed that women who had endometriosis and went on a FODMAP diet actually had clinical benefit, or the diet showed clinical benefit in reducing these symptoms that I had previously mentioned.
Right. So can you tell us a little bit more for people that don't know about FODMAPs? What is FODMAP?
So FODMAPs are basically carbohydrates or sugars within the body. So it's an acronym that stands for fermentable oligosaccharides, monosaccharides, disaccharides, and polyphenols. So kind of a mouthful. And so these are sugars or carbs in our diet that aren't actually properly digested.
Okay, so what then does it do?
Okay. So if you take a look at just like a healthy digestive system, so when we eat food, food goes from our mouth down our esophagus into the stomach, where the carbs and the proteins and the fat will be digested. They'll take I guess that bolus will go into the small intestine where it's further digested. All the nutrients that are extracted will go into the bloodstream. And then whatever is remaining goes into the large intestine. Water gets absorbed out, and whatever bacteria, this is a long one, whatever bacteria are in the large intestine will go ahead and just kind of eat the remainder of the carbs and the proteins and whatnot. But when a person has IBS, everything's pretty much the same, but once the food or the remainder of the bolus gets into large intestine, the bacteria inside there will actually begin to ferment the remainder of the carbs and proteins, mostly carbs. And basically what will happen is that you're going to get the symptoms of the gas and the bloating, even abdominal pain, constipation, and diarrhea. And so that's why a lot of people will go ahead and recommend a FODMAP diet for individuals who have IBS. And now with this latest research for women who, or those who have endometriosis, they'll recommend a FODMAP diet to help decrease those symptoms.
That's promising.
Yeah.
And I have to say, I mean, there are definitely clients that are coming in that are knowledgeable or have heard of a FODMAP diet or have been prescribed by their GI specialist or somebody else that they've seen to try the FODMAP diet. So at least it's a good, promising option.
Yeah.
So what about other recent studies about food and endometriosis?
Yeah, so there was a really cool study that came out in October talking about fruit and vegetable intake in endometriosis. And unsurprisingly, women who, and they studied women, so women who consumed a higher amount of fruits and vegetables actually had a reduced risk of endometriosis.
Wow. And so that's both fruit and vegetable, but if you look at between the two, what did this study show?
Yeah, so they actually separated fruits and they separated vegetables. So they found that fruits, specifically citrus fruits, had a higher risk reduction than vegetables. So women who consumed about 3 or more servings of fruits per day had a reduced risk compared to women who are only consuming 1 serving of fruits per day. But when it came, so this might be shocking to you. It definitely was shocking to me. So women who ate vegetables, specifically brassica vegetables, so those are cauliflower and cabbage and Brussels sprouts. So women who consumed those fruits actually had an increased risk of endometriosis.
Oh, why? But why do you think that is?
I think it's because of the whole FODMAP picture. And so they may not have been digesting them properly. And if we take a look at the study, women could have been diagnosed with endometriosis throughout the study. It wasn't, I do believe it was the nurses study that they took a look at. And so the FODMAPs food specifically can cause that pain. And so when they were eating these fruits and vegetables, these vegetables, in fact, the authors hypothesized that this might have been the tipping point that led to an endometriosis diagnosis. So it wouldn't be that, don't eat broccoli and don't eat these types of foods, but, if you're experiencing pain, endo might be something to consider.
Interesting. Yeah. So that's with regards to food.
Yes.
So aside from food, what else can a woman that is, affected by endometriosis, how else can they manage their endo?
Totally. So unfortunately, there's no cure for endometriosis. And in fact, there's no real cause as to why it happens. Everyone has all these theories, but we don't know exactly why. And so when I talk to my clients, I like to look at modifiable causes of what can we do just to help reduce the amount of pain and the amount of risk. And so typically that would involve looking at the inflammatory piece and then looking at the estrogen piece. So definitely you can go home and start researching a FODMAP diet, maybe eat an orange and, see how that goes for you. But I do recommend just looking at some testing to see, where the inflammation is within your body, and then look at supporting estrogen detoxification within the body as well.
Okay. So what do you mean by that as far as estrogen detoxification goes?
So we want to make sure that you're having a bowel movement every day, basically.
Okay.
And then we want to also
Okay,
Yes.
but how does a bowel movement kind
Really?
of link into estrogen detoxification?
Yeah, so that's a really great question. So basically, when we eat food and the food just travels and is waiting in the colon to be excreted, basically, or let me back up a step. Estrogen is also detoxified by the liver, and once it like completely detoxifies or metabolizes, it gets added to, I guess, like the garbage or
Right.
junk, and also travels to the colon.
Right.
And so once it's sitting in the colon, it's awaiting, it's kind of like a subway, right? You're just
Right.
waiting for the subway to get to the next station. If it doesn't leave the body as often as we would like it to, so at least once per day, that estrogen, bacteria can find that estrogen within the stool and basically take it out and let it recirculate it back into the body.
Wow.
Which is kind of interesting. It's a very it's a very simplified way of thinking about it.
Yeah.
But so you can imagine if you have someone who, I don't know, doesn't experience a bowel movement for maybe 3 days, like their stool is sitting there, and if you don't have the right balance of bacteria in your gut, then like the bad bacteria can go ahead and just take estrogen out, which then may lead to, you know, estrogen dominance symptoms, which you might experience like during your period. So like more pain, more cramping, breast distension, like that type of thing.
Right.
Yeah.
So it's all kind of making sense. I mean, more reason to have a regular bowel movement, everybody. But having a really good diet will, you know, in a lot of ways,
Definitely.
have that fiber in the diet and be able to have regular bowel movements.
Exactly.
Which is perfect for the estrogen detoxification.
Totally.
Yeah.
And so this is like a good reason why, when, you know, if you're considering doing a FODMAPs diet, to see like which foods, you know, are either aggravating your system or not, and that way you can just increase like these fibrous vegetables to ensure that you're getting enough fiber throughout the day.
That's great. Really good tip. So when we're looking naturopathically, how else can a woman manage their endo with regards to either treatments or testing that can be done?
Okay, so I'll talk about tests first, and then we'll switch gears to treatments. So as I mentioned, inflammation and estrogen detox are really important modifiable causes. And so when it comes to inflammation, one of the most inflammatory things like that affects our body is our stress.
Yeah.
So stress is incredibly inflammatory. And when we have a lot of inflammation going in our body, that can actually lead to increased sensation of pain. So I often tell my patients that, you know, we all experience stress, but there are different phases of stress. We can be wired and tired. We can be completely exhausted. And so in order to really find those out and find out what treatments are best, it's worth taking a look at that cortisol pattern to see how it's functioning throughout the day. So I actually took a look at this myself last month. I did a test to see where my cortisol level was at, and thankfully, like, it was better than I had expected it to be. But I think for me, like, it was really important for me to do that because it gives you a more accurate picture of like, okay, then how do we treat? And if I hadn't done that, I probably would have still been taking something for my stress that I didn't need to. So you're saving time, you're saving money, and you're learning a little bit more about your body. One more test that I want to mention that might be really important is to see how estrogen detoxifies within the body. So to make this incredibly simple, there are 3 ways that estrogen can detox. There's a 2 pathway, a 4 pathway, and a 16 pathway. We want we want most going down the 2 pathway. That pathway is the healthiest, while 4 and 16 aren't really as healthy as we like it to be. So if you find that estrogen is being metabolized through the 4 and 16 pathway, we're going to want to switch that, because what can happen is estrogen, that metabolic process can actually cause, you know, cell damage, DNA damage, and more oxidative stress within the body. And, you know, down the line may actually lead to like an increased cancer risk, which, you know, no one likes to think about. It's a scary C word, but if you have the information showing you how we detoxify estrogen, you can kind of catch that and switch it. Yeah.
That's good to know.
Mm-hmm.
So those are the tests.
Yes.
Now, we've talked a little bit about treatment, but I have some endometriosis clients that have tried things like acupuncture. So what are your thoughts on acupuncture or other treatments?
Yeah, I love acupuncture. It's one of my favorite treatments. Yeah. I love it personally, but I actually have a lot of clients who notice benefit once they get acupuncture done. It might be that self-care time where they can just lie down for half an hour. It might just reduce the sympathetic nervous response. And actually, really great news, another study in 2017 showed that with endometriosis patients who had acupuncture done, acupuncture can actually go ahead and reduce the sensation of pain, which is really, really positive. And it's something that I do in clinic all the time, so I really like it. There's nothing to be scared of.
Oh, no. Yes. I love acupuncture as well. So, anything else as far as other treatments or?
Yeah. So, right now, there's a lot more time and energy going into the field of endometriosis, with all these celebrities kind of coming out and saying that they have it, and, governments like Australia just putting more money into funding, which is fantastic. They've also looked at a couple of supplements as well. So, for instance, turmeric, which is, an herb. Specifically, turmeric has a phytoactive compound called curcumin, which can be helpful and reduce the amount of pain, plus will help the liver detoxify, which is great, and also N-acetylcysteine. And so those are two treatments that have human studies behind them, which is great because a lot of new studies only have rat or mouse models. So those are two human studies that actually show some promising results in the field of endometriosis when it comes to decreasing the amount of pain.
And with turmeric, it's is it an anti-inflammatory as well?
Yes, so it's definitely an anti-inflammatory, and so it's great, if you wanted to go out and grab yourself a turmeric latte or a golden milk latte. Those are really delicious. Although I will say with all supplements, they do, when these studies happen, they test a certain dosage. And so you just want to make sure that, having the, turmeric milk smooth or coffee or latte is great. But if you're using it specifically for endometriosis and to help reduce the pain, it's really important that you're choosing a high quality supplement with the appropriate dosage as well.
And of course, that's something that you would be able to
totally
help people with.
Exactly.
That's awesome.
Yeah.
There's some really good options.
Totally.
Anything else that you think is important or we haven't really talked about?
I want to talk about if you are considering a FODMAP diet, maybe how to do it in the process.
Sure.
So definitely, if you have a naturopathic doctor or you are working with a holistic nutritionist, get their perspective on this too. But a FODMAP diet basically works exactly like an elimination diet, where you're taking a look at, which foods are high in FODMAPs and then eliminating them from the diet for a certain amount of time, maybe 4 to 6 weeks, and then slowly reintroducing them back into the system.
Right.
And that way you'll be able to tell which foods you react to more than others. So for instance, if I take cauliflower out of my diet for 6 weeks and then I reintroduce it and I notice no pain, no change in any digestive symptoms, it might be okay for me to just add back into my regular rotation.
Right.
But if I put Brussels sprouts back in and I notice that I have a lot of bloating and I have a lot of gas, then it might not be appropriate to put back into the diet. And so maybe just avoid it for a couple more months and then, try again and see how it goes. And I did want to mention there's a really great organization, I believe out of Australia, called Monash University. And so they have an app. I do believe you need to pay for it, but it's basically a list of foods that are high in FODMAPs and that aren't. And so if you're grocery shopping, it might be worthwhile to have it on your phone or whatever to make sure that the foods that you're eating are okay and aren't okay.
Wow, that's a great resource. Yeah. What is it called again?
Monash University. Maybe we can put in the comments.
We'll put it down there for everyone. Okay, that was awesome.
Yeah,
Thanks so
thank
much.
you.
We're good? Anything
think
else?
so.
Yeah, any questions out there? Anybody have anything to ask Dr. Alexsia? Okay.
Well, if you
Yes.
do, certainly tag me and I will answer them to the best of my ability, basically. But I hope you guys found this informative.
Yeah, and if you have any questions later on, please feel free to post it, or contact us through Facebook or our website. And I think that's it for now. So we're signing off here. But before we do, just want to let you know, next week we'll be continuing our endometriosis speaker series, and we'll be talking about endometriosis and sex with Dr. Adrienne Veristo. So tune in. That's next Wednesday. All right. Have a great day.
Bye, guys.
Bye.